Hi, my name is Kurt Egerbrecht, and I serve as the health officer for the city of Appleton. We've been hosting these video information sessions the last couple of weeks, and I hope you're finding them as beneficial as we are. And thank you for providing more questions. As we learn what you're anxious in hearing or learning more about is how we're responding back to you with these videos. So thank you for that. We've reached a new point in our community that we want to make people aware that the number of cases has moved from a known case transmission where you have a known COVID case and somebody becomes ill as a result to more community-based transmission. And this is what we're seeing since Memorial Day and increasing throughout the week since. So there's a greater awareness of the need to have people take individual precautions as they're moving about within the community. So what we learned over Memorial Day weekend that we are anticipating with the July 4th holiday is that people began to socialize more with friends and family they haven't seen for a while, and certainly outside of their household context. What we experienced after Memorial Day, we're anticipating could happen again with July 4th, where we begin to see an increase. And the incubation period is 2 to 14 days from the time of exposure. So we may not even see a real rise for the first two incubation periods of 28 days. But what we really want people to be aware of is any signs and symptoms that might exhibit now that you've been exposed to others you haven't seen in a while. So those things might be a sore throat, a cough, headache, muscle aches, chills, shortness of breath, and sudden loss of taste and smell are some of the signs and symptoms that we would like people to be aware of. And if you're experiencing these, certainly call your primary care physician. And we're especially want to make sure that if you were exposed and with people that were in the high risk group, that you would be especially conscious of any new signs and symptoms. So people of age, people that have pre-existing health conditions like diabetes, heart disease, cancer, immunocompromised for whatever reason, women who are pregnant, people who are obese. Those are the risk factors that we're seeing have a greater likelihood to need hospitalization.